Hello and welcome to my presentation on the uses of augmented reality in the medical sector. The three main uses for augmented reality in the medical industry: surgical applications, education, and general situations where information is needed. AR's first recorded use in medicine was to track a bullet inside a patient using a semi-transparent screen in 1938. In recent years, data overlays are now used in semi-transparent screens on head-mounted devices such as Google Glass or Microsoft's HoloLens. Microsoft's HoloLens seems to be the most popular hardware at the moment for head-mounted devices in the medical sector for the majority of uses. It has a completely wireless system with a computer built into the device. The system costs around $3,000, has enhanced rotational tracking, positional tracking, motion control, true 360 tracking, built-in cameras, and has an inside-out laser tracking system, but requires a device to connect to via Bluetooth, such as a smartphone, tablet, or computer. In surgery, AR has proven to be extremely beneficial. For pre-surgery planning, CT scans are taken and it allows the surgeons to analyse and plan in 3D, providing more realistic outcomes than traditional analysis, helping to mitigate risk. In a study by Cui in 2015, AR proved its value in surgery. The study analyses its use in maxillofacial surgery, concluding that it increases the accuracy of the procedure, reduces the time, and makes the surgery less intrusive, as a projection of deep tissue structure can be projected onto the patient. This study once again refers to increased safety, as tooth buds and other sensitive nerve endings can be seen and avoided. This proves to be the most crucial factor of using AR in medical applications: safety. Safety is everything in medicine. Over 98,000 Americans and 23,000 Canadians die every year from medical mistakes, and this figure needs to come down. AR can be used to see non-visible vitals, like organs, arteries, and nerves, making it safer for the patient. A major application for AR in the medical industry is training. The immersive characteristics of AR will allow for more realistic training. Simulations can be used to create realistic environments, allowing for repeatability in situations that do not allow for it in real life. Overlays of data in the real world can provide new ways to teach, allowing the student to study through the skin, muscles, organs, and skeleton without needing to dissect a human or animal. A study by BMW Group has proven that AR can increase the cognitive and sensory motor skills. In the study, instructions were given to two groups. One group had paper instructions and one group used AR. The group using AR was slower by 50%, which is assumed to be as people are more accustomed to learning using paper. But those using AR made 80% less mistakes. Again, accuracy and limiting mistakes is one of the biggest carryovers to the medical industry, which proves the beneficial factors of learning in AR. Now, using AR in medicinal education will help to reduce costs. Medical dolls can cost up to almost $750,000 and have a single function, as opposed to $3,000 for a Microsoft HoloLens, and have an almost unlimited amount of use. AR will also help to reduce some of the costs of faculty, as instructions and simulations are preloaded. This could help to make medical educations more affordable, particularly in third world countries. AR has applications outside of surgery and education. AR can be used in any situation that requires data overlays. For example, the Microsoft HoloLens has built-in cameras. In-to-out tracking could be used to picture dermatological conditions and provide real-time in-situ differential diagnoses. This could help to escalate the process from consultation to diagnosis and potential treatment, reducing the anxiety for patients between consultations and potentially escalating an issue before the severity increases. Companies are currently designing systems to aid when the timing of medical history data is important, such as in emergency departments and for paramedics. These types of systems are allowing for medical professionals to access medical data faster using a hands-free system. They can also connect via teleconsults to specialists, allowing for additional advice on how to handle the situation. They connect to a cloud-based system and allow for a patient to be checked in before they arrive at the hospital. Thank you for listening. I look forward to hearing your questions.